have to give D50. It's going to look like this right here. They're going to tell you your IV's already been established. The only thing they want to know that you need to recognize is, do they need D50? How are you going to determine it?
Altered mental status.
What's their glucose level?
Blood sugar.
Exactly. That's exactly what they're going to say. And you can say, and there's going to be a glucometer stuff there, and you're going to say, okay, I'm going to do a glucose reading, and they're going to tell you, okay, it's this. All right? And I think it's 46, if I remember correctly. All right? So, is that the need for D50? Yes. What's the normal?
80 to 100?
80 to 120. Did she tell you 100?
Yeah.
It's 80 to 120. All right? There's a little bit wider range there. They're both correct, but it's 80 to 120. I think that's what's in your skills manual, 80 to 120.
So at 75, you want us to administer D50? If it's 75?
Anything below 80, and they have an altered mental status. Remember, anything outside the normals with signs and symptoms. Just kind of keep that in mind. Now, we have an adult patient. We're going to give 50. We're going to give D50, which is 25 grams. It's just diluted twice. Is all it amounts to. Okay. It's going to be packaged in 2 different ways. This is one way because it's got the needle on it, and then the second way is a needleless system, and it is right over there. All right. This one is actual D50, and I'm going to pass it around, and it's very, very sticky. All right, so if you get it on, it's like K-Rose syrup almost, and you can see where it's been tested a little bit. All right, so this is the needleless system. This is what it's going to look like, and then this is just a demo. It's nothing here but water. All right, so pass this around. Y'all look at it. If you want to take the top off, feel how sticky and stuff it is. That's okay too. All right, so one of the biggest things you need to know about D50. You got your doctor's orders. You got your glucose level that you determine that this patient needs D50. Your IV's already running, and if you have to start your IV and you're going to give D50, how big a needle do you want?
Biggest
the biggest you
get.
possibly can, because this stuff is like pushing a milkshake, all right, through a small space. It's going to take a few minutes to get this pushed. So I want to make sure I got the right drug, which is D50, and it's just 25 grams and 50 milliliters. And don't let that confuse you. It's D50. What else do I need to know? Expiration date. It's usually on the end of the box, all right, and it should be on the syringe itself, all right. It should be on the syringe itself. Now, somebody asked me about the needle a while ago. Depending on different services, what do y'all have, Randy, as far as
what you have in your hand?
with the needle, all right. So this is what this looks like. Okay, you take these off, you pop the little caps, and you screw it together. Okay, then here's your needle, all right, and it's kind of obvious. So I'll pass this one around so you can look at it also, all right. You have to get the air out of this one too. There's a little space in there because if it wouldn't, with the temperature change and that sort of thing, it would probably explode and bust. So you have to get the air out of this one too. So you make sure you get all the liquid out of it. Because see, it starts out way below zero. So the time you get ready to administer the medication, you're going to be right up there, right where it needs to be. Does that make sense? So y'all pass that around and let you look at it. With a needleless system, and a lot of people go into, you just take the little cap off, and the IV ports are usually, they're like this, but they just take the little cap off, you screw the syringe in, and then you administer the medication. With the needle, and that's what this system is, you use the needle. Does that make sense? It's either a needless system or it's not.
Do you clamp off the top or?
Yes, and we're going to get to that. Yes, we are. Very good. All right, so my IV's running. Okay, I'm going to leave it running right here. I ain't going to do anything else. I've got my doctor's orders. Blood glucose level is, we'll say 50 for all practical purposes. I've got the right medication, the right patient, the right drug, the right expiration date, so everything's good to go. Now, the key thing you have to remember about D50, did she tell you the contraindications or some of the side effects of D50?
No. We went over on that when we were going over drugs.
Okay, what is one of the definite side effects of D50?
High blood sugar.
Okay, it'll give you high blood sugar, but it necroses the skin. So you got to make sure that you have a good IV running, because if it's filtrated and you blow the vein and you start seeing swelling underneath the skin, you need to discontinue your D50 administration because it necroses the skin. Matter of fact, it kills the skin. Why? Because it's so much sugar content it just kills and destroys the cells. Does that make sense? okay? So, my IV's running, got my doctor's orders, I got the appropriate medication by whichever system we're using, and I'll simulate this one being a needle for the simple fact that that's what we got here, okay? I'll take the alcohol prep, my IV's still running, clean off my port, make sure that I got my medication cleared out here. I want to inject it into the port. I want to pinch off my line. Not below it, but above my port. Does everybody understand that? Okay, pinch it off. It's still running, but I've just got it pinched off. I want to give half the medication, so I'm going to push half of it. And it's going to take a few minutes to do that because it ain't going to push real fast because it's so thick. I'm going to push half of it. Then I'm going to open my IV up, and I'm going to sit here and wait for a couple of seconds. Why do I want to do that? Yeah, let half of it get on board. Okay? Then, you know, if I see the patient start coming around a little bit, which you should see almost instantaneous results, then I'm going to clamp my tube off, and I'm going to give them the other half. All right? So after I do that, dispose of this in a sharps container. And what else do I need to do? What's the next thing I need to do? Document it. Because we've already done vital signs. Because why? We started an IV. Vital signs should already been done. Because we started an IV.
We're going to trend, though, aren't we?
Then we want to check our vital signs after we give the blood sugar or the D50. What we want to do next after we document the time? Our route, which is IVP, IV push. All right. Now, what else we want to do?
Location, date.
We noted that when we started an IV. It's in our documentation where we started an IV at. Right arm, right hand, left hand.
But yeah, just reassess the patient.
Reassess the vital signs and stuff. What else are you going to reassess within 5 minutes? Blood sugar. Exactly. You should see a change. All right. It may not be a drastic change because the body has to have time to absorb that. But, you know, if the patient starts coming around talking to you, I guarantee you, this stuff is a miracle drug. You know, you got somebody all lacquered up and, you know, just, you know, lethargic, can't say, you know, they're talking with a mouthful of cotton or a mouthful of marshmallows or something. All right. And you push D50, man, they'll come around just almost instantaneously. It's a wonder drug. It works real well. Now, what else works just as good if they're able to swallow? Yeah, anything that's got sugar in it that they can consume. How you gonna let them? How you gonna know if they're able to swallow or not?
They can do it themselves.
If they can hold it themselves. Now, if they're a little bit lethargic, but you know and a lot of people they'll be sticking their tongue out and stuff at you because you know what? No, because you know the oral glucose. They know what they need and they're just trying to give you a hint. So they'll be sticking their tongue and stuff out at you, not because they don't like you, just because that's just a natural reaction to do that. So if they're doing that, you can put it on a tongue depressor, or you can put it between the cheek and gum and it's absorbed real quick and go from there, as long as you monitor the airway so that they don't have a gag reflex. All right, so a couple people come up here, you got orders for D50, I want you to walk me through the steps of how you're going to do that, because this is a critical thing for National Registry. So glucometer, and we'll practice this more in depth later when we start doing scenarios, but you know, you got your glucometer reading, let's say it's 30, got your orders for your D50, check your date, make sure everything's good to go, needless or whatever system, but you know you're going to administer the medication. Clean my port off, insert my needle, clamp off the tube, administer half of it, wait a few seconds, 15, 20 seconds, whatever, so it get in the system. Administer the other half. You don't have to take the needle out, just leave it in. After you administer the other half, discard, write down the time, then what are you going to do? Reassess vital signs and blood sugar within about 5 minutes. Okay? So somebody come up here and just walk me through those steps so everybody kind of feel comfortable with that. I don't care